Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, August 11th, providing you the update from Albany Medical Center. All right, let's jump in. These are the numbers in the 8 counties of the Capital Region. As you can see on this graph here, there are currently 34 people being treated in those hospitals with COVID-19. We seem to say this every week. This is a very consistent number.
It's a flat curve, Dennis.
Yeah.
It really is. It's been for quite some time now.
Yeah, and I think we even predicted that a month or two ago. I think we said this is where we believe we'll be for a while.
Slow burn.
Slow burn. Inside here in the medical center, the number is 12. They are all on the floor, none currently in the ICU. You can see that on the graph there, the number that is hovering between 10 and 20 for the last couple weeks. All right, Fred, it's Tuesday, and the governor updates the lists of states in which there are quarantine orders coming and going, and so we have an update.
That's right, Dennis. So some states on, some states off. So South Dakota and Hawaii have been added to the list. South Dakota, interesting. I think there's a motorcade going, not a motorcade, a motorcycle event going on there, Sturgis, with a couple 100,000 motorcyclists. Okay. So they're on the list. Rhode Island, New Mexico, Alaska, and Ohio have been taken off the list.
Good news.
So Rhode Island coming off is good news for lots of folks here who like to vacation in
For sure, because that was the only state really in the Northeast that was on the list for a while.
That's right. Really 1 week, I think, or maybe 2.
All right, so we'll see where we are next week. Staying on the COVID theme, Fred, there was some news that was breaking today about whether or not there was a vaccine that was being developed in Russia. And I think you want to give us at least what we've heard from the news on that.
Yes, so that was a news flash this morning. So this is a live virus, an adenovirus vaccine that the Russians have developed that was approved by their equivalent of the FDA.
Okay.
Now, what's interesting, Dennis, is it hasn't gone through the 3rd phase of trials. There's 3 different phases.
Yes.
The 3rd is give it to a large population and see what happens, both in terms of side effects as well as whether it works. And they haven't done that.
Okay.
And so that's not something that would happen in the United States, but they've decided to approve it anyways.
All right.
So we'll see.
We'll see
if, not what we would do in the United States.
We talked here about how with Operation Warp Speed, the way they're doing it in the United States is they're running things in parallel.
That's right.
Phase 1 and Phase 2 at the same time, Phase 2 and Phase 3 at the same time, but we're not skipping any steps.
Exactly.
So we'll see. But it's like a moon race, if you would, to see who can get the vaccine quickest. And
so actually they're calling it Sputnik 5 after the satellite that they put into space way back in the 50s.
Well, the reality is that the world will probably need multiple manufacturers making this. So
Dennis, there are 100 different vaccines in development around the world.
Incredible.
100.
Incredible.
Yep.
Back here on this campus, Albany Med Kids opened back up again today, and so we want to credit Sharon Wood, who's the director of Albany Med Kids, and her team
Great job.
for taking all the necessary steps to make sure that was going to be a safer place to open up. And the couple things, so environmental services, cleaning on a daily basis will continue. They'll actually have more rooms in which to spread the kids out, which will help with social distancing. Temperature checks, and Fred, they were talking about masking even the pre-K kids to get them used to kindergarten, which we'll be getting in the future.
That's a really good idea. Really good idea.
So we just want to credit them and thank them for their effort there, and Albany Med Kids. All right, Fred, let's talk about infection fatality rate. There's a lot of news out there trying to talk about whether or not, if you get the virus, you end up dying from it or not. And first of all, what's the number at the top, the numerator? What's the number at the top, the denominator, for infection fatality rates?
So Dennis, there could be lots of denominator numbers.
Yes.
So the numerator's the numerator. That's how many people die. The denominator could be over just the confirmed cases, or the confirmed cases that are people who are symptomatic, those that have been tested but aren't really symptomatic, those that haven't been tested, and those that don't even know that they've had the infection.
And some of those latter categories are determined based on, say, antibody testing or other
that's
things
correct.
where someone has said, hey, you had the virus, they didn't even know.
And the estimates are as high as 10 times as many Americans have had the infection as those that have been confirmed.
Incredible. So that would explain why when you see numbers published, there's often a range
Correct.
of what that infection fatality rate is. When you look at the overall population, what they're currently saying, and this is based off of data from the World Health Organization, I've seen published anything from 0.2% to as high as maybe 0.7 or 0.8%. Most people land in that 0.3, 0.4% range, which basically estimates to 1 in 500 to 1 in 250. How does that compare to flu?
Well, Dennis, so flu is about 0.1%.
Okay.
So you're talking maybe 3 or 4 times as high, but not what you might expect if you were just to base it on the confirmed cases.
The confirmed cases.
Right.
Then, of course, it gets really interesting, and we've talked about this. We're data people. You could spend all day on some of these various websites, whether it be CDC or Johns Hopkins
Yes.
or World Health Organization, looking at data. But we're interested in the data related to the infection fatality rate with children,
Right.
because there's a lot of concern with schools opening up again. So let's share some data here. In the age range of 5 to 9 years old, the infection fatality rate, as currently published by organizations such as the World Health Organization, based on the methodology you described, Fred,
Yes.
where you take that larger number in the denominator, is 0.0016%, which roughly translates into 1 in 62,000 children. So
right.
it's a really small number.
Very small number, Dennis.
Right.
Very few children.
And as you look at age ranges starting from 5 to 9 and working your way up, what you see basically is that the infection fatality rate will go up. And when you get into the population that's most vulnerable, 65 or older, you see that number is certainly much higher. But for children, it remains very low, which is great news for parents.
Particularly now as we're starting to talk about
Right.
schools opening up
Right.
and children getting back into circumstances where they may not be able to socially distance quite
Right.
as well.
However, we want to caution people that even though the children have a very low rate, they are still possible that they can pass it on, which is why it's so important for them to follow all those same safety measures.
That's right.
So they don't bring it home.
Wash your hands, socially distance, and if appropriate, wear a mask.
Yeah, that's very good. All right. Nurse recruitment. When you do things really well, you increase the goal. So 100 in 100 was our goal, to try to hire and recruit 100 nurses in 100 days, and you're doing great.
So it's not me, Dennis.
Yeah.
It's the team. It's
Yeah.
Sandy Castile, Emily Wright,
Yeah.
and Kate Keefe, and then all the other AVPs and nurse managers. But they're more than 60% there.
Incredible.
So we had a little conversation yesterday, and the new goal is 150 in 100.
I like it. I like
we'll
it.
see. We'll see if that one sticks or if
Yeah.
it goes even further.
Well, the reality is that we think we're a great organization to work at. We know that we offer a job opportunity to nurses to come and do great work, and we're finding that there's many who are interested in doing that.
So, Dennis, looking at some of the statistics, when we offer a position to
Yep.
a nurse, about 75% of the time they accept it.
Great.
So I think that speaks volumes about how often people want to come and work for us.
All right. So again, I offer my same congratulations to that team, Darlene Souza and everyone else working there. Blood drive next week. We
Blood
want to
drive.
let people know that's coming.
Next Tuesday, the 18th.
Okay.
You have to make an appointment. You can't walk in. So please support the American Red Cross.
Yeah.
Blood is in short supply.
Very, very true. Finally, Fred, we had a contest last Thursday, and we had a not insignificant number of people who attempted to answer the question.
So we asked them what was different
What was-
about the video.
Right.
We got about 75 emails from people.
Right.
And there were 10 who actually sorted it out. And the first person to sort it out was Christine Horrigan from the alumni office. And Dennis, it was 5 minutes after the video was posted, she sorted it out. And for those of you that don't know, we had switched ties. So there were lots of other things that were true about that video. The dean, Dennis, and myself all had purple ties
Yes.
on, but that wasn't the question.
Right.
There were a few other things which we won't go into. that were true about the video. But the switching of the ties was what we
So
wanted
what
you to notice.
you wore on Tuesday, I wore on Thursday,
You got
and
it.
vice versa.
That's right.
All right.
That's right.
And it must be the room, right? Because this is the alumni lounge, and so Christine must have
yeah.
channeled something
Yeah,
from
something.
this room.
So
here.
I owe her a cup of coffee and a donut. So I have to get her a Dunkin' Donuts card.
Very good.
Yeah.
And we had so much fun with it. We're going to do it again this week.
There's going to be another challenge on Thursday, so stay tuned.
right.
Put your thinking cap
All
on.
right, very good.
See if you can figure it out.
All right. Well, that's it then. So then we will be back on Thursday.
Back on Thursday.
And we look forward to that. And I think we have a couple videos coming up in the next week or so
Yes.
as well that we're going
right.
to start sharing with people.
Yep.
All right. We'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.